Hello and welcome back to the channel. My name's Ed Hope, a junior doctor in the UK, and we're continuing our look at the fantastic Cells at Work Code Black. So this is Cells at Work but set in an unhealthy body, and loads of you have been warning me about this episode, so I should pass on the warning. Cells at Work Code Black has lots of adult themes. This one's no exception. It's about STIs. It is called Frontline Gonococcus and Conflict, so it's about a gonorrhea infection. So if that's not for you, probably skip this video. For everyone else though, we're going to keep it very medical. Medicine is about dealing with difficult subjects, and this may be one of them. So let's see how they cover it. It's interesting that the bacteria is going around saying, I'm lonely, I'm lonely. I wonder if that is a kind of reference to the fact that people who are having casual sex maybe are more likely to get gonorrhea, and maybe it's because they're having casual sex because they're lonely. Maybe it's a comment on that. I'm not judging, just saying that's maybe why, because there's no kind of medical reason why the bacteria would be lonely. In fact, I think it's a bacteria that wouldn't be lonely. So the bacteria is called gonococcus. So the cocky bit refers to the fact it is a circular bacteria when looked under a microscope. And I think that's reflected in the bacteria's head here. We can see it being a circle. But also, if you looked at it under a microscope, you'd see two of the bacteria joined together in a pair, what we call a diplococci. So its colonies would look like lots of these pairs. So in a weird way, it's never lonely. And we learned that its incubation period is very short, 2 to 9 days. So the incubation period is a time from exposure to the bacteria until you get symptoms. So the type of symptoms this male would be having would be pain, so pain when passing urine, and maybe even pain around the testicle, and also discharge as well. So some kind of pus coming out at the end of the penis. They're the kind of most common symptoms. And we see one of the favourites on the channel, the platelets, and they're worried that they might get attacked by the gonococcus bacteria. They don't really have anything to worry about. Don't forget, platelets aren't cells, they're just parts of a cell that kind of budded off. That means they're not really going to be invaded by bacteria. And the neutrophils are then attacking the gonococcus here, and we see these tentacles coming out of the bacteria, and I think these are supposed to represent pili. So lots of bacteria have these. These are projections that come off the bacteria that help it do certain jobs. So in the case of gonococcus here, it would help it to adhere to things, so to stick to the cells that it's about to invade, but also to help the bacteria stick to itself. So it can form these colonies, and it kind of acts like a biofilm. So by having these colonies stuck together, it stops the immune cells getting deep into the colonies, or stops antibiotics getting in, and allows the colony more likely to replicate. These pili can also help motility, so the bacteria to move around cells and therefore attack neighbouring cells. And finally, probably the most interesting thing they do in the case of gonococcus is they help the bacteria communicate with each other in the form of transferring DNA between one bacteria and the other. So typically we think of DNA being transferred in a vertical manner, so only when a parent cell produces a child cell and then inherits its DNA, what we call vertical transfer. But this happens horizontally, so a bacteria may transfer one gene, so something is mutated, and then transfer it to the bacteria next to it, what we call genetic transformation. So allowing it to transfer favourable mutations to make it withstand the effects of the immune system. And here they're talking about what's the status of the epididymis. So what is the epididymis? So if we have our testicle here, that's a fairly big testicle, but the epididymis is the tissue that wraps on the back of the testicle and collects the sperm and then transfers it up a tube. So my thumb here would be the tube called the vas deferens, which then goes into the prostate. So the sperm follows this path, goes into the prostate, and the sperm would then go out of the urethra during ejaculation. Just to remind you, itis means inflammation. So if we get the bacteria tracking all the way down the vas deferens, all the way into the epididymis, causing epididymitis, so inflammation of the epididymis, and that is why we could get pain down there from a gonorrhea infection. And they've also talked a little bit about epididymitis here, so they'll say you get swelling of the area as well, so that's one of the hallmarks of inflammation, swelling, and it says can potentially lead to sterility. So essentially the swelling can compress that vas deferens, so that tube that the sperm needs to travel through, and therefore lead to reduced fertility. This is an interesting one. So they're saying here he shouldn't be having sex when his resistance is so low. So I'm wondering, when they say resistance, I think they do mean just the general condition of the body, but it could mean a reduced immune system, what we call being immunocompromised. Generally, we think of gonorrhea as being a sexually transmitted infection, so the access point is via the genitals and it tends to only affect that area of the body, but it can cause disseminated disease, so spread in the bloodstream and infect other parts of the body, and even cause sepsis as well. But this tends to only happen if you're immunocompromised or you have a source of infection that's kind of spreading out in the whole body, for example, if you've got gonorrhea in a joint. But it's also worth noting you can get gonorrhea in other parts of the body, for example, in the eyes, and this is particularly bad in newborn babies. So if you've got a gonorrhea infection and you're pregnant and you give birth, you can actually pass it on to the baby, a newborn baby, and this actually can cause blindness. But in the case of cells at work here, I don't think they're immunosuppressed. I just think they say his resistance is low because he's generally unhealthy. Interesting statement here. The higher ups have no clue about the front lines. I've said this a lot in the original Cells at Work, that they tend to not only be about the human body, but also reflect many themes within healthcare. So this idea that the higher ups have no clue about the front lines, I can kind of relate to. So the red blood cells, because they're rookies, have been sent to the area that's currently been infected around the urethra. I mean, red blood cells are of different ages, but they don't send immature red blood cells to particular points. But what it is highlighting actually is that when we get inflammation, we talked about swelling earlier being a hallmark of inflammation. The reason why that happens is because at a vascular level, so in the blood vessels, when we get inflammation, we get dilation of the blood vessels and we get the actual blood vessel wall becomes more leaky. So both of those things encourage more blood flow to the area to promote healing, to put more immune cells to the area and to take more nutrients to the area. So in a way, it kind of is accurate that they're more likely to be sent there if that's an area of ongoing inflammation. Sorry to interrupt you while you're enjoying this video. Just if you want to support the channel, if you're also in a pandemic like me at the moment and you want some cool face masks with cells of the immune system on, then I have some face coverings. Check these out. Please focus. There you go. They have all the cells of the immune system, and they also tell a little bit of a story because we have some coronavirus sneaking in here and some of the cells are doing the adaptive immune response to it. Loads of people have been supporting the channel with them, so thank you so much. But if you want them, there's a link down below, and you know, you can look as cool as me. So one of the neutrophils has returned back to a bunch of the other neutrophils. Now, I thought here what might happen is that the gonococci bacteria can actually infect neutrophils. So I wonder if one of the gonococci has actually infected this neutrophil and is about to kind of burst out. That is it's a bit of a mad theory, but it might come true. And that is also one of the reasons why gonococci infections are so difficult to get rid of, because they actually can infect your immune cells.
つまり淋病は自然治癒するみ
Very good point. So they're highlighting chronic infection, and this is of particular interest in gonorrhea. So they're saying that the immune system is unable to beat the infection on its own, so it's going to need the help of some antibiotics. And this has significance in sexually transmitted infections, right? Because the only reason they get passed on is because someone has it at a time, doesn't get treated, and therefore will then pass it on to someone else. So most of the time we think of infections, we get them and your body fights it, and you're only infectious for that period that you currently have active infection. But something like gonorrhea will just stay there because your body's unable to clear it, and therefore you're more likely to spread it to other people. And that's why at the moment sexually transmitted infections should be fairly low, right? Because of this lockdown we've been having for the last year. So it's a great time to get tested for STIs, because they can be asymptomatic, so you might not know you have them. So great time to get tested just for everyone's sake, because then we can treat them very easily and therefore reduce the numbers. You know, take this opportunity to really reduce the numbers of STIs. The white blood cells get this kind of pep talk from the senior white blood cell, and that kind of happens at a cellular level. So once a neutrophil be activated, it would reduce cytokines. So these cytokines will stimulate immune cells around the area. So although you may think this is far-fetched, this would be happening. So a neutrophil will be sending chemical messages to other immune cells in the area. That's their kind of chemical version of a pep talk. I'm going to call it, this is how they're representing pus. So we've probably all seen pus from spots and things. So it is, in fact, dead white blood cells. And as we said, one of the symptoms of gonorrhea is discharge from the urethra. So discharge from the end of the penis. And this will be what is coming out the end. It will be pus. And here they talk about what pus is: an opaque, viscous fluid produced at the site of inflammation.
Macrophage, 白血球の一種。死んだ細胞や細菌などを片付ける役を。
Cool, and we see the macrophage here as well. We hear about some of its other jobs as well. So when we think about the immune cells destroying pathogens, but they also have a role in clearing up bits of debris from an infection. And we see the white blood cells having another go at the gonococci. So it says here phagocytosis or opsonic action. So phagocytosis, we've seen this many times throughout cells at work. So this is the white blood cell engulfing the bacteria and then breaking the bacteria down once it's within the cytoplasm of the neutrophil. And also opsonization, I've described it before as how tasty a bacteria looks to the neutrophil. And so for a bacteria to look more opsonized, so to be more attractive to be attacked, often things like antibodies will bind onto it. So it's really how aggressive and how the neutrophil identifies the bacteria. Cool, so they're talking about the cell wall of a bacteria. So they're saying that plants also have a cell wall. So don't forget, bacteria have to exist in the environment. So they need some kind of protection that our cells don't need, because our cells operate within our body, so it gets protection from that point of view, whereas the bacteria will need a cell wall not just to protect it from the immune system, but to protect it from the environment. One of the ways we classify bacteria is the makeup of the cell wall, and we stain them under a microscope to see what type of cell wall they have. If they have two membranes, they'll be called gram-negative bacteria, and these stain red, which is kind of why I think gonococci has a kind of reddish pinkish color in this episode, because it's a gram-negative bacteria. Or if it's just got a single membrane, we call that gram-positive. It's thought that the gram-negatives tend to be slightly more complex bacteria because they've got two membranes, and they thought this has evolved later on, but that isn't always the case. What the hell? Some kind of sexual abuse. Gonococky licking a neutrophil's breast was not something I expected to see today. Red blood cells mate is exactly right here. There's nothing they can really do. The job of the red blood cells, nothing really to do with the immune system, but you know, they need to provide oxygen to the area, which is what the tissues need. Oh, okay. I just thought the red blood cell there had some kind of immune cell type power to kill the bacteria, but actually it's just a coincidence that as he does his speech, we see an antibiotic and it looks like it's breaking open the cell walls of the bacteria. Yeah, very nice. So we see the bacteria here being used is penicillin. So penicillin as a chemical has part of it called a beta-lactam ring, and this binds to the cell wall of the bacteria as we see here and makes it very difficult for the bacteria to maintain this cell wall, which is so important for its survival, and therefore the immune system can come in and do its job. Nowadays we don't use penicillin's first line to treat gonorrhea. We'd actually use cephalosporin, which is actually a very similar chemical. It also has this beta-lactam ring, so would work in the same way. And it's also just a one-off dose, so one-off injection, and that's enough to tilt it in favor of your immune system and to get rid of the infection. The bacteria doesn't look so strong without its cell wall now. And this is another really interesting point, right? Often in medicine we feel like all the work is done by doctors and us giving the patient medications, but we always forget that the body is doing a hell of a lot of work itself. So when we give antibiotics, we're just really helping the immune system. So much of the work is also still done by the immune system. Okay, so the T cells now have been primed to deal with this infection, but the infection's gone. So they may start accidentally attacking the own cells. Maybe that's what we're going to see in the next episode. So there you have it, my thoughts on another fantastic episode of Cells at Work. I actually thought it gave a really good view on gonorrhea and gave us some good things to talk about in terms of the gonococky bacteria and the immune system's response to it. In reality, this type of disease would come with it a lot of stigma, won't it? We talked about that in the last episode where we covered erectile dysfunction, but we should never be embarrassed about this type of thing because it means we're kind of probably less likely to seek medical advice and less likely to get things sorted out and more likely to then pass it on to other people, or more likely to have the complications with it as well. So this is a great way of actually educating people about these illnesses. And as always, thank you so much for all the ongoing support on the channel, all the likes, all the shares, all the comments. And if you haven't already, why not subscribe to the channel? You guys just blow me away when I've had kind of a tough shift to kind of log on and see how much you enjoy these videos. It really means a lot to me. And if you want to support the channel a little bit more, we have the face coverings that I mentioned earlier. You can check them out in a link down below. So until next time, I'll see you soon.